genetic predispositions that are there, that under stressful situations or under certain other types of situations, we can be manifested by having certain illnesses that manifest with behavior. The Royal College of Psychiatrists in 2006 basically said that young people aged 16 years and under should not be admitted to adult psychiatric units. So that brings up another point. We have one psychiatric bed for 8,000 people in the Cayman Islands. One for 8,000. How many medical beds do we have per person? One for 256 people. That's a big difference. I think we can do better than that. How many beds do we have for teens and adolescents? And when I talk about beds, don't picture an old psychiatric unit where people are shackled or put in straitjackets. I'm just talking about a safe area. How much of the stats are we seeing that are pointing out to young people not feeling comfortable in their environments, feeling threatened that they need to take weapons? But we don't have any safe places for them, with the exception of the tire lodge, which is wonderful. But we need to have a hub, and a hub does not need to be a long-term care facility. So to answer the other second part of the long-term care facility, how would it benefit young people? It would benefit young people by taking all of the long-term stayers out of the hospital. We have 8 beds, 8 psychiatric beds for 64,000 people. That's an embarrassment. Not only is it an embarrassment, but it's unsafe. Because what happens right now is that when we have to admit a young person that is actively suicidal, that's cut themselves, that needs medical management with the emotional care, we have to put them on a unit with adults. Many times, how many times was it referenced today by different speakers about setting boundaries with young people that are going through trauma? And re-traumatizing them in terms of them feeling that they're being threatened around adults and others. So you can imagine putting a 16-year-old that's been abused, that's anxious and depressed, on a unit with 45-year-old men that are looking at them, that are making comments, and so on. It's extremely challenging. So that brings us then to what we need to do. We need to establish a crisis assessment hub, a safe home. It can be a 4-bedroom house, a 3-bedroom house. It does not have to have 16 beds. It does not have to be a 3-story building. In the same way that we have a crisis center. In that hub, we would have a 24-hour online call. We would have private-public partnerships in terms of having the professionals come in and out. We would be able to triage and assess young people based on what they're going through so they get the appropriate care. It doesn't stigmatize them and push them away from the care they need, and it enhances the treatment. It's that simple, ladies and gentlemen. And we need your help. The Alex Panton Foundation, with the Loud Silent Voices, which is another foundation, the Mental Health Commission, the Ministry of Health, we're all going to work together, but we need the help from the private sector. Down the line, we want to add other things to supplement that, because our goal is not to move towards ever opening and setting up a long-term care or an extended care facility for young people. We don't want that type of facility. We want a hub that's encouraging to be able to attenuate crises, and then have other things, vocational and technical interventions. Like a wilderness ranch, maybe work with the YMCA to have groups of young people with therapists walk the Mastic Trail a few times and have other things going on. We can have a team of young people go to Cayman Brac and camp and do different activities in the summer. So we need to become more creative with our interventions for our young people. We need mobile crisis teams. We can't have everybody here in Georgetown. We have no psychiatrists in Cayman Brac. The Wellness Center is doing a wonderful job by going over and flying over, but we need to move around. We need to have 2 or 3 professionals that have a proper van, drive to Northside on a Tuesday afternoon, are there for 3 hours, playing with the young students, talking with them. Those that need help can be addressed. Friday afternoons, we're in East End, and set up a process where we can go to them. Because remember, a lot of the young people too that we treat and that we see with these statistics are not coming from a home where they have parents that have the time to bring them to appointments. One of the issues that we see is the missed appointments. It's very high, and it's higher among those who actually need it the most. Because again, they don't have the parent support or the caregiver support to bring them in for treatment. We need to go to them, go to the schools, go to where they are. We spoke about NAU. We had Ms. Paulinda here. We need referrals from the Ministry of Education. We need to identify early identification, not waiting 10 years. I just went to a conference in Florida. An eminent psychiatrist from the University of Wisconsin has been doing research for many, many years on primates who are very similar to us in behavior. Fascinating study that he showed with videos of what he called the anxious personality, where he's been tracking for many years young people, and we've all seen it, like with little children that are anxious from birth, almost, that are hyperreactive. And he identified a type of reaction, and we've seen it where you'd see a little child, for example, like a 3 or 4-year-old, and you're new, and so they might say hello, and the little child would stand there and kind of look and then start crying. And that behavior, that freezing, anxious behavior, happens in primates also. So young primates will be playing, a strange person or one of the lab techs walks in and just stands there, and the primate freezes. They've been able to track brain changes and patterns of behavior that young children that have that anxious type presentation have a high risk of anxiety in adulthood. There are connections with the brain, connections with the mind, connections with our environment, and that's how we have to address this. Ladies and gentlemen, thank you very much. Special thanks again to the Adolescent Foundation, to all of you for the work you do. And as I said when I started this, for keeping Alex alive, but alive in the hearts and minds and healing of those with challenges.
Ladies and gentlemen, we've reached the final chapter of the day, and what a day it's been. We've heard so many different statistics, we've heard inspiring stories from people who are living the experience. It's been an incredibly remarkable day, and I think I want to echo Dr. Lockhart's congratulations to the Alex Panton Foundation for putting this amazing symposium together. A big round of applause. Our final speaker is Hailee Robinson, and she is the Deputy Chairperson of the Alex Panton Foundation. She's completing her legal training as an article clerk at the law firm Maples & Calder, having completed her LPC at the University of Law and Master's in Law from the University of Bristol. Preceding this, Hailee completed a dual major in International Development and Anthropology at McGill University in Canada. Hailee is an ardent community advocate with experience volunteering from an early age, which she now does as an executive member, deputy chair, of the Alex Panton Foundation. And she is also a founding member of the Alex Panton Foundation. Ladies and gentlemen, please welcome Hailee Robinson.
We are very thankful that you could all be here for the second annual Alex Panton Foundation Mental Health Symposium. And even though the information presented today was sobering and scary to some, we are glad to see all the interested partners in the community that are willing to sponsor and assist us in addressing the issues mentioned today. The Alex Panton Foundation remains committed to improving mental health, children and young adults in the King Highlands by raising awareness of mental illnesses affecting children and young adults, providing hope and resources to those suffering, addressing the stigma surrounding mental health through providing and promoting educational resources to the community, seeking to address discrimination against young people affected by mental illness, and advocating towards the development of public policies to ensure adequate access to health insurance coverage and other public policy issues. An example of our efforts in this area have included our recent proposal to the Law Reform Commission to decriminalize suicide in the Cayman Islands, which is currently a common practice. Other ways we aim to achieve our mission are through educating friends, family members, teachers, classmates, and the wider population on how to identify and successfully interact with those suffering with mental illnesses, and providing resources to friends and family that we have done today with our amazing speakers. We cannot do our work alone. Our board is made up entirely of volunteers, and the foundation has engaged other nonprofit organizations and individuals in order to strengthen our resources and create a cohesive service for our community. We depend on passionate, enthusiastic volunteers and partners, such as the YMCA, the National Drugs Council, Mental Health Commission, Ministry of Community Affairs, HSA, Loud Silent Voices, and Bethesda Counseling Services, and other incredibly generous sponsors to continue the work that we are doing to better the lives of those struggling with those mental issues. When we formed the foundation, we knew from personal experiences and stories that we heard throughout the community that our young people were suffering, but we had no idea exactly how many or the extent of their issues. We had some data from the 2007 student survey and PAHO survey in 2013, but we didn't have any recent comprehensive data. Early on, we knew we had to undertake a national survey, and the National Drug Council was just about to undertake their biennial survey. So we asked if we could partner, and they enthusiastically agreed to include mental health questions for the first time ever in their national drug survey. As we have discussed here today, the results of the survey, which we intend to conduct every 2 years, will help inform our policy efforts and shape the content of our psychoeducational workshops. In order to ensure that our workshops and other community projects are productive, we conduct our own surveys so that we can assess and receive feedback on how to improve our services. An example of the way we utilize data to inform our practices are the topics that we have selected for the 2019 Community Workshop Series. In the last quarter of 2018, we partnered with the Ministry of Community Affairs to present a series of community workshops on self-harm and suicidal ideation across all the districts in Grand Cayman and in Cayman Brac. The topics we prepared originated from our foundation's focus on anxiety and depression and the correlation between deliberate self-harm and suicidal ideations. These were also matters that the Ministry of Community Affairs identified as pertinent. The foundation has presented at PTA meetings, churches, after-school programs like the YMCA, and youth leadership events such as Key Leader in an effort to actively engage with our community and raise awareness on mental health issues. Next month, we are starting our new community workshop series, and our 2019 topics are anti-bullying, young men at risk, and nutrition and mental health. As you remember from Dr. Lamb's presentation, bullying is one of the key risk factors contributing to attempted suicide, and accordingly, we need to address this topic. Young men at risk is another relevant topic because we know our young men are suffering in relatively unique ways. An example of these is engaging in delinquency and other risky self-behaviors, which are again two major risk factors when addressing the likelihood of self-harm. Our data is telling us that these areas desperately need to be addressed, and our 2019 Community Workshop Series are a prime way in which our foundation utilizes evidence-based practices to target specific community needs and overall improve our services. We want to take this opportunity to once again thank Cayman National Bank, who made a generous 3-year commitment to sponsoring our support groups. We've had requests from members of the community and also the Ministry of Community Affairs to offer various support groups, and we are partnering with Loud Silent Voices to support the carers and those individuals who are living with anxiety, depression, and other mental illnesses, as well as offering a bereavement support group and peer-led support group. April Lewis is a registered counselor from the Bethesda Counseling Center who has graciously volunteered to lead the bereavement group in collaboration with Alice Panton Foundation. Alice Panton Foundation's very own Shane Purcell will be facilitating the peer-led group, and Jackie Neal from Loud Silent Voices is leading the support group for carers. The care group will be meeting this Tuesday, the 26th of February, at Smith Road Center, not at HSA. Dates for our other support groups will be released shortly on our website and social media accounts, so please stay tuned for more information. The Foundation has secured an exclusive partnership with internationally recognized organization, Partnership for Children, to implement an emotional literacy program in the Cayman Islands. The program will teach our young people how to recognize their feelings, understand where they come from, and learn how to deal with them in a safe and productive manner. The program is widely used both in the UK and in 30 different countries around the world. There's also a modified version of the program that is suitable for children with additional needs and disabilities. The reason we are bringing this program to the Cayman Islands is because our survey identified that a significant portion of mental health problems are linked to a lack of emotional intelligence in our young people. And this program has been shown to improve emotional intelligence and social skills, productivity, and academic performance, all while reducing anxiety, depression, and instances of bullying between students. Research has shown that young people with high emotional intelligence often earn higher grades, stay in school, and make healthier choices. It is also significantly easier and more cost-effective to nurture healthy and emotionally resilient young people than repair broken adults. It has been identified by the Mental Health Commission that there exists a gap between access to care in our young children and young adults. Currently, our only 24-hour facility is A&E, and some young children, as Dr. Lockhart mentioned, are not comfortable accessing care at a general emergency room. If you recall from the data we presented earlier, only 5% of children who actually attempted suicide accessed help. 5%. We are partnering with the HSA, the Ministry of Health, to offer an emergency mental health hub for children and adolescents who are in need of mental health services in a supportive, professional, and age-appropriate environment. HSA has already identified a space at the hospital, and we are currently seeking sponsorship with the hopes of implementing the service at the start of 2020. Going back to our working model, we want to ensure that after all these services are implemented, we're going to continue to collaborate with the National Drugs Council to survey our own services and improve our efforts and prove that they're also being effective in 1, reducing the risk of suicide, 2, improving the quality of life of our young people, and 3, building a healthier and more resilient next generation. Today we've taken the time to reflect and address our past, and we need your help moving forward to support our future. Once again, we would like to thank our generous sponsors for joining us in this endeavor towards making Cayman a healthier environment for our young children. Our sponsors are Cayman National Bank, Iron Shore Pharmaceuticals, Ministry of Community Affairs, Maples Group, Hurley's Media, Ministry of Health, Tower, Walkers, Logic, Appleby, PwC, Augier, and Pinnacle Media. We hope you all enjoyed today, and we look forward to seeing you all at our future events. Thank you very much.
Another round of applause for Deputy Chair. I also want to ask you all to join me. You've seen some ladies and gentlemen running around and volunteer on their name tags. They have been working very, very hard to put us all together. I'd like you to give them a big round of applause. Thank you all so much for your support of today's event. I hope that you all found something that you can take away. As Dr. Lockhart said, he's challenged all of us now to leave here today, to go away and do one thing that is going to make a difference. So I encourage you all to make sure that you do at least that one thing maybe 2, and we'll look forward to seeing you here again next year. Take care.